Hi, my name's Ashley. I'm taking care of you today. Can you please state your name and date of birth for me? Okay, thank you, Ms. Patient. Today we're actually going to be changing your dressing, so it should go by pretty quick. So I'm going to provide some privacy. I'm going to raise the bed up to a working level. Lower the side rail. I'm going to wash my hands. I'm going to put on some clean gloves. I can get my red bag set up. Just exposing the area. Lay this right here. I'm going to carefully peel it off, going towards the wound. And I'm going to look at the bandage for the amount, the color, and the odor. It's a scant amount with a pinkish red color, and there's no present odor. So I would fold that up and throw it away. Now I'm going to assess the wound and look for the size, the color, the odor, or if there's any drainage. The size, it looks like about 4 by 1 by 1. There's a pinkish red color, just be expected. There's no present odor, and I don't see any infectious drainage. I'm going to throw my gloves away. I'm going to wash my hands, and now I'm going to prepare my sterile field. My gloves, get them over here. Get my drape. Under the patient's wound. I'm going to use sterile solution. Set that over there. Okay. Now I'm going to pour my sterile solution. Now I'm going to put on my sterile gloves. I'm going to remove this tape real quick. Okay. Now I'm going to put on my sterile gloves. Scoot this over. This away as well. Now I'm going to clean the wound. Get a 4 by 4 to dip it. I'm going to wring it out. And with one swipe, going from cleanest to dirtiest. Throw it away. And another 4 by 4. Serious away. Serious. Throw it away. Now I'm going to measure the wound. Okay, like I said, it's 4 inches wide. It's 1 inch across. I'm going to go ahead and get a Q-tip to measure the depth. It's about 1 inch deep, so I was correct on my assumption. Go ahead and toss those 2 things. And now I'm going to pat the wound. Get a 4x4. And go ahead and undo it before I get it wet. Dip it, get it all wet, bring it out. Coil it in my hand, fluff it. Make sure all the surface is covered, but not packing it too tight. Toss that. I'm going to get some 4x4 to lay on top. D-pad, blue side up, on top, to take off my sterile gloves. Now I'm going to tape in a window pane fashion, all 4 sides. Put another piece of tape on top. Would initial, date, and time it. Okay. Then I would gather my supplies, have a patient get over, cover her back up, clean that area. Dispose of this. Ensure patient safety, make sure the call light is within reach. I would wash my hands and I would document how the patient tolerated it, the size of the wound, if there was any drainage from the wound, if there was an odor, the amount of drainage if there was any. The size of the wound was 4 by 1 by 1. There was no drainage, there was no odor. I used a sterile saline wet to dry dressing, and I ensured patient safety, and I would be done. I disposed of my area.